She said we're gonna read it.
We're starting one. We're starting one.
Okay, go ahead. We're going over disorders that did not exist.
What happened? Your hair
That's
still
a
on?
question. That's what I do. Disorders that did not exist before pregnancy. Um, Whatever occurrence that can put a woman and the fetus at risk. They are hypertension in pregnancy. I can hear me, right?
Yes, good.
Hypertension in pregnancy. Hyperemesis. Write it down.
What is that? Look it up.
Hyperemesis. Something has
Excess vomiting. Excess vomiting.
Whatever.
Excess
Read
vomiting.
it through the book. Oh, y'all gonna put it on me? Read it through the book. Next one. Hemorrhagic complication.
Yes.
And surgery
Bleeding
during
complication.
pregnancy, trauma, infection. Those are everything that can put.
Surgery during pregnancy? You could have a surgery when you're pregnant?
Yes, if you have some other issues going on, yes.
Really, that's possible?
We're talking, listen. We're talking
Surgery.
about that can put the woman and the fetus at risk. So those are some of them. Any other questions? All right, we're moving on.
Oh my God, you could be a good teacher.
Hypertensive disorders of pregnancy are the most common medical complication reported. We have preeclampsia, the significant contributor to maternal and perinatal morbidity and mortality. Okay. Next. We're still going over the hypertension in pregnancy. Classification, we have gestational hypertension, preeclampsia, eclampsia, chronic hypertension, preeclampsia superimposed on chronic hypertension. Yes. Any question?
No,
We're just going over this. Gestational hypertension, which we were supposed to do the case studies, so we have an idea of pretty much what it is. It's when the systolic is over 140 and the diastolic is over 90. So the woman is at risk and the fetus is at risk as well, and we call it gestational hypertension. And the diagnosis of onset during pregnancy is based on two measurements of the criteria for gestation. We're gonna start making you stand up, whoever's talking.
yes, good.
Alright, preeclampsia. It's a pregnancy-specific syndrome, so it only occurs during pregnancy, and it's whoever knows what preeclampsia is, kind of like a seizure disorder, right? During pregnancy. That's all I got. Miss, you got something important you gotta do?
Quick. How do I come back if you're not
Next.
Okay, so
Good job.
it's complicated 3 to 7% of all pregnancies, and proteinuria may be present, which is protein.
What does that mean?
Protein in your urine.
Professor, I
That
have
was
a
for
question.
preeclampsia. The eclampsia is the actual seizure activity or coma in a woman diagnosed with preeclampsia. So we're moving from preeclampsia to eclampsia. And usually this lady has no history of previous seizure disorder. And the presentation may varies, could be on the third, 1/3 in labor, 1/3 during delivery, and 1/3 within 72 hours postpartum.
Professor, somebody's video taping. Yeah, kick him out. They can tell, right?
Chronic hypertension. I didn't take present before the pregnancy or diagnosed before 20 weeks of gestation. That is for chronic hypertension. And chronic hypertension will superimpose preeclampsia. So now this lady not only has preeclampsia, but she also has chronic hypertension. It's a woman with chronic hypertension that may require preeclampsia or eclampsia. And we're still going over at-risk pregnancy, and that increases the mortality rate for the mother and the fetus. This is just the etiology of preeclampsia. We can read through it because we just need to know the nursing consideration and what to do. We don't need to know the whole
That's what
pathophysiology. We need to understand the pathophysiology of the disease in order to understand what the disease does and how can we as a nurse make some conscious decision for the mother. For some of y'all would like to read the map, go over that. Now we have the HELLP syndrome, HELLP syndrome. It's a laboratory diagnostic variant of severe preeclampsia that involves hepatic dysfunction, and it's characterized by hemolysis,
Elevated
liver
enzyme.
and the low blood test. So technically, the HELP is a test that they do to diagnose the preeclampsia, just like we do the CK and B to diagnose. Hello?
To diagnose the disorder.
B to diagnose heart failure. Really?
Oh, those are enzymes.
All right. The HELLP syndrome is associated with an increased risk for pulmonary edema, acute renal failure, disseminated intravascular coagulation, placental abruption, liver hemorrhage or failure, adult respiratory distress syndrome, sepsis, and stroke. So all these signs, when we see them, that will indicate to us that this mother has what we call the HELLP syndrome. And we already know what to look for in the lab to find out if that mother is active. Those are high risk for and it's also a high risk for maternal death. Sorry.
Okay.
Care management, which is what we supposed to do as a nurse. Consistency is taking the blood pressure reading and recording. So we need to have a baseline and keep matching it to make sure that whenever we see some inconsistency, that means the mother or the fetus or both of them will exactly evaluate. Electronic blood pressure devices are less accurate, so we need to do the actual call, listening to the baby. And reading are affected by the maternal position, which means we all know that we cannot lie the pregnant woman on their back, so it depends on how the mother is laying down, that may affect the reading.
Why?
Why?
How dare you?
Just say why.
Keep going.
So now these are stuff that shows the feeding edema.
Why should I lay back?
We all know these things. And we have a mild gestational hypertension and mild preeclampsia. And when we have a patient with mild gestational hypertension and mild preeclampsia, the goal is to ensure maternal safety and deliver a healthy newborn. May be safely managed at home. Maternal and fetal assessment, which is what we do. Activity restriction, we let the mother know what she can and cannot do, and encourage a diet that may alter her lifestyle.
Positive.
Severe gestational hypertension or severe preeclampsia. So we went from the mild to the severe, so we all know the difference. It was mild, now it's severe. Boom, we got it. Eclampsia. When the mother has the actual eclampsia, we need to monitor some signs and symptoms. Some of the signs and symptoms will be the patient will be complaining of headache, blurred vision, severe epigastric pain, and also an altered mental status. Tonic-clonic convulsion, which is the actual eclampsia, hypotension, and currently coma.
Coma.
At this point, coma, C-O-M-A. At this point, the patient requires immediate care, and the first thing that we do is to ensure catheter away and the patient's safety. And we go for procedure decision regarding timing and method of birth, because at this point, the mother is unable to push, so we need to find out for an alternative way of delivery. And we go back over the HELLP syndrome, we evaluate the lab, and then we do a blood transfusion. Now, what do we do if we have a patient that is, for some religious issues, cannot do blood transfusion?
We let them sign what they need to sign.
That was a serious question.
That's the only thing I can say. We offered you said no.
Hypertension associated with increased incidence of abruptio placenta, which is the abruptio placenta.
The disconnection of the placenta in the uterus.
Preeclampsia, increased perinatal mortality, and fetal effect, which consists of fetal growth restriction and small for gestational age. So the baby
just not getting enough blood.
Is smaller than the actual than what it's supposed to be.
I mean the baby is petit.
And the ideal management should begin before the conception. The lifestyles change may be necessary, such as diet, exercise, whatever we can do to help the patient have a good delivery.
Lifestyle modification.
Excuse me?
Lifestyle modification.
In postpartum, high-risk women monitored closely should be monitored closely for complication, and they may safely breastfeed even though low level of anti-hypertensive medication will be in the breast milk. Because as whatever the pregnant lady takes, it's gonna be transferred to the baby through the breast milk.
Risk management.
Excessive vomiting accompanied by weight loss, electrolyte imbalance, and ketonuria.
Ketonuria.
Ketone in the urine.
What are ketones? What are ketones?
Ketone. Read about it.
No, what are ketones?
That's what was that? Diabetes message to last year with Miss.
I think it's metabolized fats.
Assessment, initial care, follow-up care. Hemorrhagic disorder in pregnancy or medical emergencies. Well, we all pretty much know that. Maternal blood loss decreases oxygen carrying capacity. So now the mother by becoming